because the reason we're talking to you here is just trying to look at these issues clearly. There's an issue of air pollution that is caused by mining and power stations, but those are the main employers in the Highveld area. And then there's the issue of now the country needs to decarbonize and try to transition towards a green energy economy. With all of those issues in place, but there's a health issue that we have just spoken about. That look, people are dying. You may cry for jobs that are being created by the coal industry, that they are going to be they are well, with the coal being phased out, those jobs are going to be lost. You can cry about that, but now here's the main thing: the health of the people. There have been many studies around the Highveld priority area, which it stretches from exactly. Yeah. From Eguruleni up to Mpumalanga.
Yeah, Nkangala district to Hartsibande district.
That involves towns like Middleburg, Witbank, Delmas, Emelo, Standerton even.
Standerton, Leandra,
that area.
Even all of those areas.
It's a 30,000
hectares
kilometer square area. People are getting sick there, and there have been reports. You'll know better. Expert reports indicating that 2,000 people die per year due to exposure to the polluted air.
That is only linked to ESCOM.
Only linked to
ESCOM. Yeah. So we've had several studies. I mean, we had Dr. Ronsa, who I think we had Mike Holland, both doing health reports. For groundwork and the Center for Environmental Rights. And the purpose of this was to show decision makers, especially politicians, to say, you need to act, you need to make decisive actions. And we're not asking them to do people a favor. We are saying we've got a constitution, and part of the constitution says we need to ensure that the environment is taken care of for our well-being right now, but for our kids as well, because they are the future generation.
Exactly.
So that's a social contract we have with government, and they have to deliver on it. So we're not asking government to do people a favor. All we're saying is, this is what we have to do. You have to protect people's rights. Now, that hasn't happened. You started by saying this area has been declared a priority area. And that declaration basically meant this area is highly polluted. Therefore, we need to come up with interventions to address pollution, to protect people's health. And it's like those interventions must yield positive results. It's immediate. It cannot be progressive.
Well, when was it declared a high priority area?
The area was declared a priority area in 2007. I would say it took us 5 years to develop an air quality management plan, which we finally had in 2012. And since 2012, nothing has happened.
So basically, after that declaration, just to simplify it for people, then government had to come up with ways of protecting the people against exposure to the polluted air.
That's right. So the air quality management plan basically seeks to address that. And it had a couple of goals to say, by year 2015, this is what we must achieve. By year 2020, this is what we must achieve. And I mean, just to make an example, in terms of the air quality management plan, everybody recognized the fact that government, especially local government, does not have the capacity to deal with air quality governance. There were no air quality officers. There were no environmental management inspectors. So that's one of the areas, for instance, would say government needs to build capacity. Since 2012 until 2015, they need to build capacity. They need to ensure that every municipality had an air quality management plan. It had enough budget to do monitoring and enforcement. It had the right tools, like for monitoring, to say where is the source of the pollution coming from, so that the polluter pay principle could apply. But by 2015, we had none of that. So if you look into the current situation and you say in 2015 we were supposed to have enough air quality officers, enough environmental management inspectors, but we still don't have enough of those, then we'd see how intentionally government is failing in terms of air quality governance. But also that led to a groundwork, Center for Environmental Rights and Mnguni to say, wait a minute, let's do an assessment of the air quality management plan. Is it functional or is it completely dysfunctional? By 2017, we launched our report, which we titled back then Broken Promises. We called it Broken Promises because we were looking into the air quality management plan, which had clear commitments to say we must achieve this by 2015, but nothing was happening. And then we presented that to government, I think 2017 Air Quality Lekgotla, to say, this is the assessment we have done, and these are the outcomes, and these are the recommendations. And what was pressing in the regulations was, we had an air quality management plan which lacked the teeth to bite. You have a plan which you couldn't use to hold somebody accountable. It was just quiet. It was a plan, it's there. But if somebody was non-compliant, you couldn't use the plan to enforce compliance. So at that time, we called for the development of implementation regulations. But the minister and the air quality officer said, we're having none of that. We have the air quality management plan. But I think quite a nice coincidence that happened at that time. When we were doing our own midterm assessment of the plan, government was doing the same. Fortunately, we came up with the same resolution to say the air quality management plan is not working. But they were very reluctant to develop implementation regulations.
But it was there, it has been there since 2017. Was there anything done at all? Because you're mentioning a point of municipalities still not having the capacity since then.
Well, nothing much changed, except for the provincial government had to cede some of its competencies to the district in terms of licensing. So now the provincial government is no longer a licensing authority, but the district municipality is. But taking those functions also meant you must have your own inspectors. And there wasn't any inspector at the municipality. I think even recently we're still asking how many environmental management inspectors do we have? Because training an inspector is one thing, making sure that the inspector is properly designated, given the powers, to have access to the facilities is the most important thing.
That's another thing.
So even recently, we're still fighting about that to say, what is the level of capacity? Are we getting enough human resource to deal with this thing? But again, out of that process, realizing that nothing is happening, I think we gave the minister from 2017, I think October, November, to respond to the broken promises. They promised to say, we'll provide you an extensive response by January 2018. That never happened all the way until 2019. In 2019, we said there's enough communication. We've waited for the minister in the department, so we're taking the matter to court. So we took the matter to court, and I'm not going to touch on all the orders we were asking for.
No, that's fine. But as you took the matter to court, what did you want to achieve?
So there are two things that I want to touch on, basically. The first one was for us to get the court to declare that what is currently happening in the Highveld is in violation of Section 24 of the Constitution, which speaks about a healthy environment. The second one was to ensure that they give an order that the minister must develop implementation regulations. Now, I would say the third one, which I kind of like, was that we need a clarity from the court to say Section 24 is not a progressive right. It is a right that must be realized immediately. We cannot postpone people's right to health or a healthy environment. It must be realized immediately. And fortunately, the court confirmed that to say this is not a progressive right. It must be realized immediately. They confirmed to say the levels of pollution in the Highveld are in violation of people's rights, especially Section 24.
It's a basic right to live in a clean environment.
And they ordered the minister to develop implementation regulations, which they've done after 2 years, because they've only been finalized last year, August. But that has been done. I think what is missing now is for us to see the implementation regulations working, because they cannot keep making excuses to say, we're setting up systems. But what is problematic now is, I think there is, I don't know whether it's intentional or what, but government is doing monitoring. They monitor the air. But what we have seen is that their data has been very unreliable, even though part of the order in court was give people reliable data, But we've seen most of the monitoring stations are becoming dysfunctional, and they have all sorts of excuses. So that they don't have the necessary analyzers, or they will tell you it's vandalism, or we didn't have power. But up until now, we still don't have reliable data. But interestingly enough, whether the data is reliable or not, even now with the limited information they have, with most of or some of the power monitoring stations being dysfunctional, we can still confirm that in terms of their assessments, air quality in this area is still in non-compliance, which basically tells you that there's a huge negative health impact people are still experiencing, irrespective of the fact that the matter was taken to court. They were ordered to develop regulations and ensure that they enforce them so that we can bring this area into compliance.
Exactly.